Hi, I'm Dr. David Warwick of Warwick Chiropractic. Today we're going to talk about tingling down the leg, or what's that tingling down the leg. So many of us, when we see or experience low back pain, we think of someone holding their lower back and bent over, especially in acute pain. Many of us will experience low back pain. 80%, even up to 80% of people will experience at one episode or multiple episodes throughout their lifetime. And this is kind of the what we call the acute phase. But also associated with the low back pain are shooting pains down the leg. That can be one or both, and when you experience that, that can also include what's going on down the arm. But people more commonly, everyone thinks they all have sciatica, so that term can be used quite a bit. So I'm going to help you understand, and I'd like to use a little model to help you understand a little bit more about what's going on when you feel or experience that tingling in the back. I'm going to reference my notes as well a little bit later, but we're going to start out with an anatomy of the spine, and we're looking at the two large bones right here are the vertebral bodies. That makes up the biggest portion of the spine, is the body. Coming off the two sides right here, we have the transverse process, the little bumps that we feel on our back right there. This is called the spinous. In between each of the vertebral bodies are the discs. That's what gives us our height. And in fact, when we get up in the morning, we tend to have more of our height, and that's why you have to change your mirror and adjust your mirror in the morning and the afternoon, because we can lose up to an inch or inch and a half of height throughout the day as those discs start to shrink and compress in through the body. In between the two joints here, that's called the facet area, and right in between where the vertebral body and the actual spinous is, we call that the pedicle area, right in through here. And between each exiting hole is the foramen, the foramen, where the nerve exits through here. So I'll be referencing that as I go through and reference my notes. And here you have the spinal canal. So all these are all components of what comprise the vertebrae, things that we look at in there. Obviously, there's other components that we look at as well, but some of us, I'm going to reference more particularly where that tingling could be coming from, is that some of us have more genetically a shorter pedicle, and you don't always know that until you take some films of the low back and can see that. That's right where the exiting nerves are, and that can compress on that narrow opening a little bit more. This is called foraminal spinal stenosis. This compression usually occurs later in life when there's osteoarthritis, or what you hear a term arthritis, and or degenerative disc disease. Osteoarthritis is like the spurring. You have the degenerative disc disease, where the disc starts wearing away, and that can crowd that foramen where the nerves exit the actual spine. Other short pedicles can narrow the central canal as well, where the spinal cord travels up and down the communication from the brain down through the cord and out the spinal nerves. And those talk to the cells, tissue, organs in your body. That's your communication. It's like what I reference your main CPU, or the computer, the hard drive, even the fuse panel in the house. That's how I reference it or give an example to people. Later in life, when these effects combine and the canals narrow, you can have bulging discs. You may have osteoarthritis or spurs, combination of those, even thickening or calcification of some of the ligaments. And this can add up to what's called central spinal stenosis. Some of the symptoms associated, whether it's foraminal or central stenosis, can include difficulties walking, an increase in the tingling or heaviness feeling that you feel in your legs, crampiness, achy, sore feeling that's happening in the legs, either one or both of them. The tingling in the legs associated with spinal stenosis is what we call neurogenic claudication, more involvement with the nerve, and must be something we have to differentiate. Vascular claudication, which is similar, but is caused from a lack of the blood flow from the arteries or the veins to the legs, as opposed to nerve flow or the communication of, of the nerve. At a younger age, many times the legs can be affected by either a bulging disc or a herniated disc, as well as joint misalignments in there. Usually a facet, or what we call a SI joint, or where the sacrum meets the ilium bone. That's part of your pelvis. The facets, as I described earlier, are these two joints right here. Just a misalignment of there can create a lot of the back pain that you feel. The main difference in symptoms between nerve versus the joint leg tingling symptoms is that the nerve pinching from a deranged disc is associated with a specific area in the leg, such as inside or outside the foot. In other words, a tingling can be traced to specifically in the leg. And so many times a patient will describe by tracing the pain for us, and they show us a certain pattern that's going on in the body, and then we can differentiate simply by, a lot of the evaluation is done by what you tell us and what's going on, what you're feeling, because we will never know what you exactly feel in your body. We can only know and reference what we find and what we know from what we've studied and worked with patients. So the generalized achy tingling that can affect the whole leg can even stop at the knee, go back down the knee, come into the front of the thigh area, go all the way down the leg into the foot area. Those type of symptoms described in their location. So chiropractic is one of the management for a non-invasive approach, an effective non-surgical approach in taking care of low back pain guidelines when it comes to involving or treating these type of conditions. I hope that you learned a little something today. You can reference my blog at What's This Tingling in My Leg at drdavidwarwickblog.com. Feel free to call my office, 360-951-4504, or reference or review my website at drdavidwarwick.com. I hope this information helped you out in understanding of more about what's that tingling in my leg. So I'll see you. I'll have another video for you soon.